Hello and welcome to the State of 911 webinar series hosted by the NHTSA National 911 Program. My name is Kate Elkins and I will be the moderator for today's session. This webinar series is designed to provide useful information for the 911 stakeholder community about federal, state, and local participation in the planning, design, and advancement of 911. It includes real experiences from leaders utilizing these processes throughout the country. In today's session, we will be discussing telecommunicator mental health and welfare, highlighting the impacts of a career in 911 on personnel and ways to recognize and manage those impacts. Today's webinar will be recorded and will be posted on 911.gov. For more information on the National 911 Program webinars, to access the archive of recordings, or to learn more about the National 911 Program, please visit 911.gov. For closed captioning, hover over the bottom of your Zoom screen for meeting controls. Then click the CC button to start viewing the captioning. Feedback or questions about the webinar can be sent to NHTSA National 911 at dot.gov. The National 911 Program would like to highlight the Documents and Tools section of 911.gov. Next slide, please. Which has been updated with new resources and improved access to these resources. 911 stakeholders are encouraged to submit links and documents that would be of use and interest to your 911 colleagues, including policy documents, plans, and reports across several topics, including governance, management, operations, post-crash care, standards and best practices, technical. And since we're talking about mental health, if you have a fabulous resource or mental health related document, whether it's a research paper or anything related to the topics we're covering today, please feel free to click on Docs and Tools, click and share button in order to share your resource. So to find this part of the web page, you can access it under Resources, the drop-down menu, or scan the QR code on the bottom right corner of the slide. Content once submitted is reviewed, and then once it goes through the review process, can be posted on the Docs and Tools page. On this Docs and Tools page, there is a search bar that is specific to Docs and Tools and makes it easier for you to find specific resources that are posted. Next slide, please. The National 911 Program would also like to invite you to visit the 911 Telecommunicator Tree of Life and share the name of a remarkable 911 telecommunicator who has inspired you. Share your story at 911treeoflife.org to honor those special 911 telecommunicators who are making a difference in your community. Please note that all participants' phone lines have been put in a listen-only mode, and this webinar is being recorded. To ask questions of our presenters, feel free to take one of two actions. Using the Zoom QA feature located at the bottom of your screen in the meeting controls, you can enter your question at any time during the presentation, and it will be entered into the queue. Hover your mouse over the bottom of the page to access meeting controls. Or to ask your question live, use the raise hand feature to request to have your phone line unmuted so you can be called upon to ask your question. Individuals registered for this webinar will receive access to today's PowerPoint presentation and the webinar recording. All of these will be posted on 911.gov. We may not have time to cover all of the questions, but please do submit your questions and they will be answered and posted after the webinar if we run out of time to answer them today. With that, I'm going to start off with a quick introduction about who am I and why am I one of the presenters. So my name is Kate Elkins. I'm an EMS and 911 specialist in the NHTSA Office of Emergency Medical Services and the National 911 Program. I am also a doctoral student at the Johns Hopkins Bloomberg School of Public Health and an American Health Initiative Fellow, studying how the occupational exposure for EMS and 911 contributes to mental health sequelae. I have had a passion for improving the mental health and wellness of the EMS and 911 workforce for a long time, as I'm still an active paramedic with 26 years as an EMS clinician. I am so excited to be presenting with Dr. Michelle Lilly. Dr. Michelle Lilly is a professor of clinical psychology at Northern Illinois University and a researcher who has published extensively about first responder mental health, especially focusing on 911 telecommunicators. This is a critically understudied population. We need more research to better understand telecommunicator mental health. Her dedication to improve research and resources for the mental health of telecommunicators has made a significant impact on our community. Thank you, Michelle, for joining me in this discussion of what we know and how we can continue to improve research and resources for the mental health of our workforce. And we will be recording the webinar, posting the webinar, and providing the slides for everybody. All right, next slide, please.
Hi, everyone. Very, very pleased to be here today with such a great group. I'm going to try really, really hard to not be distracted by the Q&A because I am very conversational when I present typically. And so I would love nothing more than to be reading your questions and answering them, but throw them in there and hopefully we'll have some opportunity later. So what does research show about general mental health in 911? Well, we know that many 911 telecommunicators go from being quite healthy at higher to much less healthy over time. I ran a very small study of 911 telecommunicators early in my career. This was probably not quite a decade ago, but found that out of brand new hires from some folks across the country, only 1 out of 40 screened positive for PTSD or depression. That person was a veteran who was managing their symptoms very well and was actually doing quite well in their training. But it's low, right? And that number makes perfect sense because many agencies do psychologicals, right? We do psychological screening to make sure that people are doing well, that we hope can then handle the job better. That being said, I know lots of agencies that are moving away from doing psychologicals, which is a whole other ball of wax that if we want to talk about later, we can. But in that same study, we also found that only 18% fell into the overweight or obese category. And this is when we ask people to self-report their height and weight. So generally speaking, people come into this occupation and they're doing pretty well in terms of, some rough indicators of their overall physical and psychological health. Next slide, please. But then we experience a lot of stress, right? And so we're going to talk about the ways in which some of the stress could really impact people over time. So this was a study that I was involved in with some folks out of the University of Washington, and they surveyed a large sample of 911 telecommunicators from the state of Washington. And what they found is that the symptoms of stress, when you kind of compared them to other populations, were in the moderate range. Now, this was a little bit surprising, right? Because we know that is a very stressful job for reasons that we're going to get into in a second. And I think the way that we can interpret this and the way, I go across the country talking about these topics, people often say that number is probably because folks in 911 have become so accustomed to the stress that they are very likely to be underreporting it, which is certainly something that I see. I walk into centers and people will say, "Oh, I don't experience stress," but I can literally see it in their face and in their shoulders. Now, when that study was published, we looked at where the highest scores of stress were noted, and very reasonably, they were in the areas of muscle tension, sympathetic arousal, so increased heart rate, sweating, more shallow breathing in response to stress, and anger, right? So anger was a very common symptom of stress reported by respondents in that study. Now, I'm going to pause here really quickly. Some people may have heard me say this before, but anger is often usually secondary. I know a lot of 911 agencies where people say, "Oh, man, I have coworkers and they're just so angry." Well, anger is often secondary to more vulnerable emotions like feeling trapped, vulnerable, helpless, fearful. And so sometimes when I say, when you have that stressed and angry colleague, what you might be looking at is somebody who's really struggling. So that's just a little pause and a little tangent, but I always feel like I have to say that before moving on. So generally speaking, again, numbers were moderate overall. Those were the areas of highest scores. But again, this is likely the case of underreporting. Now, the reason I would say it's underreporting is if we can go to the next slide. The 911 work environment has a lot of inherent stressors. So there's probably been, oh gosh, billions of dollars at this point spent studying stress and what its predictors are. And we're going to go over some more of those in a second. But when we're specifically looking at 911, what we find is that individuals who reported that there's a lot of effort in their center, they're putting in a lot of effort for their agency, and they're not experiencing a lot of rewards. Those people are reporting the highest levels of stress. People who are overcommitted, and you probably know a couple of those folks, right? But they're very, very committed to the job. They're committed to the agency. When people are overcommitted, oftentimes they're experiencing kind of a low level of balance or harmony between their workplace and their home life. And we know when people are overcommitted, they tend to report more stress. Also more techno stress. So folks who are generally more stressed out by the idea of technological change, which in 911 is always abundant, tend to experience more stress. When people have less control, perceived control over their work environment or over information that they're given about their work environment, they report more stress. And mindfulness. That should be actually a minus behind the mindfulness. So people who had higher levels of trait level mindfulness actually reported lower levels of stress. Now, again, we could talk about mindfulness all day long. It's outside the scope of today's webinar, but if you want to talk about mindfulness, I'm your girl. Just reach out to me at some other time. Now, when we put all of these things in a big statistical model and we compare them and we make them all duke it out, what we found is the largest effects were observed for overcommitment and mindfulness. So when people can develop trait level mindfulness, which is a skill you can cultivate, it reduces their stress level. And importantly, overcommitment is also something that we can kind of target for change on the individual and organizational level, which we'll get to in a minute. All right, if we could move along. Again, there's been lots and lots of probably billions of dollars of research on predictors of stress. And when you look at all those things out there in the world, all the contextual factors that can increase risk for stress, these four factors almost always rise to the top, right? Novelty, right? New task demands, new types of calls. I mean, 911, I think it never ceases to amaze me when people tell me stories about a new and interesting and difficult call that they may have handled. And again, in addition to all the technological changes that need to be adapted to, unpredictable, right? What's coming next, right? We as human beings, we crave predictability, and when we don't know what's going to happen, it increases our stress level. Lack of control, when we don't feel as though we have a sense of agency over what happens to us, we tend to experience more stress. And social evaluation, if people are watching, right? Now, I always say that this basically sounds like a 911 job ad, right? You like novelty? You want to not know what's going to happen next? Do you want to sit in a room where everybody can monitor what you're doing? Join 911, right? These things are quite inherent within the 911 work environment. Generally speaking, these aren't things that probably are going to change a whole lot, even though there are some things that we can somewhat address, right? I'm always telling management and leadership, as much as you can provide information that restores a sense of control for people, the better they're going to do. So again, these are the four leading predictors of stress, very inherent in the work environment. If we can move to the next slide. These are, again, a lot of things that we can't change in the 911 work environment. I don't know if there's ever going to be a way that we can make it more predictable so people will know what's going to happen when they pick up the other end of the phone. I'm not a technological guru or expert, but I would imagine that would be quite hard to do, right? But all we can do is think about the stress and react to it. And what we think about the stress matters, both in the primary and secondary appraisals that we make of stress. And we're going to return to that in just a little bit. If we could go to the next slide. Let's pause here for just a minute and think about clinical conditions. So we're kind of returning back to those early numbers, right? So again, as I mentioned, 911 hires tend to go from being quite healthy physically and psychologically, at least based on rough indicators, into a career that is quite stressful for any number of very reasonable reasons. And over time, that stress and recurrent exposure to trauma can heighten risk for a number of clinical conditions. Now, depression is one of them. So if we could pull up the numbers for that. In the research that I did and published in 2015, we found that almost 1 in 4 911 telecommunicators screen positive for current major depression. 1 in 4. At the time of collecting that data, the national rate was about 12 to 13. So nearly double the rate of the general population. Now, right now, post-COVID, those numbers both for 911 and the general population are both a bit elevated. But generally speaking, in all the data that I've always collected, risk for depression is usually 2 to 3 times higher in telecommunicators than what we see in the general population. And that number doesn't include the 22% who have additional symptoms, right? So they have symptoms that are in the mild to moderate range, but they're not quite frequent or severe enough to warrant a probable diagnosis. Now, there can be lots of reasons why work in 911 can increase risk for conditions such as depression. One of them is just the recurrent stress, right? When people are physically and psychologically depleted and exhausted, it increases their risk. When people stop participating in things that are naturally rewarding to them, right? Either because they're exhausted or because they're psychologically suffering, they tend to experience depression. So the more withdrawn, the more isolated, the more recurrent exposure to stress, it can really increase this risk for depression. In addition to the fact that 911 telecommunicators are almost always talking to people who are having one of the worst days of their lives. So 911 folks are recurrently exposed to people who are having a bad day, experiencing really horrific events, overly exposed to people doing bad things to other people, right? And over time, that can really wear down our sense in the benevolence of people in the world, which can also increase our risk for conditions such as depression.
And I just want
Okay,
to
if we can,
flag that compared
yeah.
to their first responder colleagues, as a paramedic, I can run a really difficult call. I can see really horrible things, but I still have to clean the ambulance. I still have to finish my paperwork at the hospital. I'm likely to have a moment to process, and I'm likely to see some of the outcomes. And oftentimes in the 911 center, you don't have that break. You're on to the next call. Is that correct, Michelle?
Yes, absolutely. And I think that that's another kind of source of recurrent stress and depletion, right? You're on to the next call, you're on to the next call. There's oftentimes very little ability to more immediately process the event with your colleagues. So I also work a lot with law enforcement, and oftentimes if there's a critical call or a particularly stressful or distressing call, in the aftermath, people can kind of come stand around and talk and kind of say, man, this happened, or man, that was awful. So there's more built-in opportunity for processing these things and receiving informal peer support in other first responding occupations. And therefore, not surprisingly, these numbers in terms of depression, we're talking about PTSD in a second, are consistent with, or in fact higher than the rates of depression, PTSD that we see in other first responding populations. And I think a lot of that, again, does have to do with some of the basic elements of the work environment. If we could continue on to the next slide. Again, when we talk about PTSD, if we could pull up those numbers here. The study that was done in 2015, we found that about 17 to 24% of 911 telecommunicators from across the country were reporting symptoms of PTSD severe enough to warrant a diagnosis, meaning that if they sat down and did a clinical interview with a clinician, they were very likely to be diagnosed with PTSD. And an additional 15 to 20% were experiencing symptoms of PTSD, but again, those symptoms were maybe not severe enough to warrant a diagnosis. This is, of course, quite concerning, right? Because we know that when people are experiencing PTSD, they're having trouble with attention, decision making, concentration. A very common symptom of PTSD is insomnia, poor sleep, which is already difficult for first responders, especially if they're working 12s or overnights. Sleep is already challenging. And when we know when we're not getting enough sleep is we have a harder time regulating our emotion the next day. We're more likely to see threat in our environment than is actually there. And so there can be lots of different reasons why having PTSD could be present a real barrier to effective work performance for 911. I'm going to say these folks were actively working in 911 at the time of the study. And so while it is concerning, we also know that there are a lot of folks in the 911 industry who are struggling with their mental health, whether or not it's in terms of PTSD or depression or both, but they're still performing and they're still doing a good job, but they're suffering, right? They're experiencing things that are very uncomfortable and certainly warrant attention. Okay, so if we could continue on. In terms of physical health, there's very limited data on the prevalence of disease. So to my knowledge, I have not seen anything on the prevalence of, for example, heart disease or other specific conditions in 911. This is just based on data that, again, I collected with over 800 telecommunicators from across the country. And again, in that study, we asked people to self-report their height and their weight to calculate their body mass index. Now, what I will say is people are pretty good at reporting their height. Although, like me, I feel like I'm shrinking over time, but generally people are pretty accurate. People are not very accurate in self-reporting their weight. More often than not, if you have somebody self-report their weight and then you have them come in and get on the scale, they are more likely to underestimate their true weight. So these numbers are likely an underestimate of the extent of weight concerns and obesity. But in that study, we found 83% fell into the overweight or obese category. And in fact, 53% fell in the obese category alone. Now, at the time of that data collection, there were about 35% of the general population fell into the obese category. So about 1.5 times more likely. We also found that telecommunicators reported an average of 17 different physical health complaints in the last month alone. So that is, headaches, muscle tension, back problems, itchy eyes, any number of those things, which again, some of that can kind of make sense, right? It is a kind of sedentary occupation. People are spending a lot of time sitting, which we know is not good for our health, watching lots of different screens. So there's a lot of things that are kind of inherent in the physical work environment that could be contributing to these physical health concerns. But research also suggests that some of this might be what we call somatization. So in first responding culture, it's typically a little stigmatizing to say something like, hey, I'm feeling really sad today, or I'm feeling overly anxious, or I'm having these more vulnerable emotions. It is more kind of culturally normative to say, oh, my back hurts, or man, I've been having headaches, or I've been having these other kind of physical health concerns. And what we see in first responding culture is that sometimes reporting these physical symptoms is more culturally appropriate. So it might be what we think of as kind of a culture bound syndrome in first responding to have psychological concerns manifest as physical health concerns.
And
So,
I totally represent that population. I have 100% done that myself as a paramedic, where you
Mhm.
complain about your back or you complain about something else, not to complain about being upset. I think one of the things I want to highlight that's so important is the fact that we can't find the research. We need to do this research to better understand the health impacts on our populations. But when you were talking earlier about fatigue, interrupted sleep or problem sleeping really influences your blood sugar, your blood pressure, your cardiac health, your ability to lose weight if you need to lose weight or maintain a healthy weight. It impacts your blood sugar pretty significantly. So it really makes sense that this is all kind of a confluence of things that puts us at a disadvantage in this workforce for maintaining both physical and mental health. Would you agree?
Absolutely. I mean, if you ask me, and I'm always like hesitant to say this because when I talk about it in first responding crowds, sometimes I get like the evil eye. I get glares, which I totally understand, but since we're on a webinar, I can't see anybody's face, I'll just go ahead and say it. Sleep is critical, right? It really is critical to our physical and our psychological health. When we are not getting adequate sleep, we are dramatically putting ourselves behind the 8 ball in terms of our physical health and our psychological health. So they've done studies where they hook a bunch of people up to actigraph watches, so they're measuring their sleep and then how they're doing throughout the day. And if you get 30 minutes less sleep, just based on your average, not compared to like 8 hours or 7 hours, but if you typically sleep, say, 5 hours, and then you have a night where you only get 4.5, and then the researchers ping you the next day. So throughout the day, they just say, hey, what sort of moods are you experiencing right now? Just getting that 30 minutes less sleep dramatically increases the risk of you reporting negative emotions, sadness, anger, frustration, and dramatically reduces the likelihood of reporting more positive neutral emotions like joy, happiness, contentedness, peace. And so even getting less than our normal level of sleep really makes a huge impact in terms of our stress management and our emotion regulation the next day, in addition to all of the other physical health consequences that it has for us. So I think sleep is probably one of the central conduits through which these physical and psychological outcomes manifest. And then I would also say, cortisol dysregulation, right, which is also tied to sleep. But when you're kind of recurrently having these stress reactions where your kind of cortisol's coming up and you're going into fight or flight, and then your body's having to calm you back down. And then before you even know it, you're on to your next fall, your next stressor. By the end of the day, you're kind of quite elevated in terms of your overall kind of threat responding, your autonomic arousal. And we're having these kind of big fluctuations in cortisol throughout the day that can impact, again, everything from, sleep, weight, everything in immunology, everything in between. So I would say kind of sleep and cortisol are probably two of the largest.
Yeah, and cardiac
factors.
fitness and blood sugar are also impacted.
Yes. Yep. Absolutely. Absolutely.
Awesome. Well,
So,
so I don't want to hurry you, but if we go to the
oh,
next slide, um,
yeah.
I'm one of those people that I can't talk about all sorts of negative things without saying, hey, there's some really cool research that there's some positives that we can do that are simple, that are low cost. And this is something that even if you're still connected to your headset, you could march in place potentially. But there is some research that's come out relatively recently that indicates that, sitting all day increases our risk of heart disease, diabetes, and dementia. And that's the general population. This is not specific for 911 professionals, but when you're looking at this kind of research, and there's multiple studies, and I can get citations for anybody who's interested, but we know that sitting for prolonged periods of time increases risk. And some studies are saying it's comparable to increasing the risk the way smoking increases your risk for cardiovascular health problems, et cetera. So there's been some neat research where they actually brought people into a lab and monitored their blood glucose and their cardiac markers and a couple other things to see like how much walking and moving and getting up will actually reverse some of that impact or mitigate some of that impact, and in as little as 5 minutes every 30. So if you actually had a timer on your phone or your watch that says for every 30 minutes I need to walk around for 5, and you don't necessarily have to be disconnected and walking a long distance, you just need to be walking, that can really offset those physical impacts of that sedentary position. And I know that there are plenty of 911 centers that are putting treadmills under standing desks and giving standing desks, and that's going to help us move forward to try and mitigate some of these physical environmental factors that are influencing the health of our workforce. But I think it's really important to recognize that you don't have to have a treadmill under your desk. You don't have to have a fancy standing desk. You just have to have the ability to get up and move for about 5 minutes of walking every 30 to start to counteract those effects. And I recognize that most telecommunicators are not going to be doing that every 30 minutes, but any time that they do that for a 30-minute, after a 30-minute period of sitting, it has a positive impact on their health. So just something to flag as an option that is simple and can be done in any PSAP. Next slide, please.
Absolutely. Kate, I love that too, because I think sometimes people feel with some of the stuff like, oh, I need to be exercising 30 to 45 minutes a day. Like we can make very small behavioral changes in our lives that have huge impacts. So
And
again,
then
we're not going to talk about mindfulness today, but even if you're kind of a practice with mindfulness, meditating even 4 or 5 minutes a day can have profound positive psychological, physical consequences.
We're so on the same wavelength. I was about to say, there's a reason why the mindfulness app starts at like 30 seconds.
Yeah.
30 seconds or a minute. Like, you don't have to invest big time. Small changes make big differences in your health. And again, I'm putting my health educator hat on. Start small, accomplish
Yeah.
small, reasonable goals, celebrate those successes, and you'd be amazed how they add up. Sorry, go ahead.
No, absolutely. Kate and I could literally sit and talk about this stuff for like days on end. So, but we don't want to hijack your next 48 hours. So, okay, so let's talk about again, I'm kind of like Kate, I don't like to focus on all the negative without thinking about how can we address this, right? Because there's lots of strategies, there's lots of things that people can do. On the individual level, what I always say to people is resilience and wellness is not something that you stumble upon, right? It is not something that you just kind of hope to build, right? In order for people to become and stay resilient, they have to really proactively engage in self-care strategies. So whether or not that is, adopting a mindfulness practice, right? Or again, getting up and walking for 5 minutes, or seeking informal or formal support. In order to be resilient, folks really need to develop a plan. Some people are naturally resilient. That's awesome. They have high grit. That's amazing. But not everybody's like that. For most people, it requires concerted effort. And so, in those strategies, and I don't have it on here, but I'm going to just pause here really quickly. They can't compete with each other, right? So, starting small is key. If you thought to yourself, like, I'm going to get 8 hours of sleep, I'm going to cook organic, fresh food that's well balanced, I'm going to meditate 20, 30 minutes a day. I'm going to walk, blah, blah, blah. That's all you would do with your life, right? Most of us do not have that luxury. So starting with one strategy, adapting one strategy at a very small level, right? Even if it's 5 minutes a day, is the start of something that can really bolster your resilience. Because once you get in the habit of doing this one 5 minute thing, and it's part of your, just part of your, it's a habit for you, you can adopt a next one, right? So starting small, starting strategically, and starting with one thing at a time, and then not shaming yourself if and when you come up short, right? We come up short all the time because life is busy and crazy and hard. We work crazy schedules. Boundaries is another. I talk about this all the time. Generally speaking, I'll be honest, I see the slightly younger generation being a bit better about boundaries and saying no, but that is most certainly not the kind of history of first responding, right? Where it's like, if you need me, I will come. And there's, I trust me, I get that. And I appreciate that very deeply about the first responders who, especially who serve in my community. But we are also kind of trained to sometimes not say no to things that then kind of inundate us with commitments. And so one of my favorite quotes, I can't remember where I first heard it, is no is a complete sentence, right? Being proactive in how we protect our mental health is critical. Talking, right? And I know that's easy for me to say as a clinical psychologist. Of course, I believe in talking, but we know that just saying words lights up areas of the brain that become underactive when people are withdrawn, isolated, or oppressed. Like, I could give you just a list of random words, and saying those words to another human being will actually be helpful for you, right? You don't need to talk always about your feelings. If you're trying to provide your support to somebody, you don't need to go in hot and be like, how are you feeling? You can just ask them how their day's going. Ask them how their kids are doing. Ask them if they caught the game last night. Just talking is really important. And what we also know about talking is that it helps us process and make meaning out of life events. So our brains like nice, clear, coherent stories that have a beginning, middle, and end. And in the absence of, and that kind of makes sense to us, right? Kind of fall into our life narrative. In the absence of that, if we haven't kind of processed things, our brain starts kind of sending up error messages, right? So then all of a sudden, when you're in the shower, or you're driving to work, or you're in a moment of calm, you're trying to sit and watch TV, go to bed at night, all of a sudden your brain is sending some nice, fun, intrusive thoughts into your brain, into your mind, like, hey, remember this thing that happened at work that pissed you off that you haven't processed yet? Now is the perfect time to think about it, right? But if we actually sit and talk, right? If we talk about these experiences inside of work, outside of work, it is helpful, right? Talking works, right? And again, that can be seeking support from people within your agency or seeking support from outside peers, right? I think oftentimes what we see in first responding culture, and I totally get it. And by the way, I'm married to a law enforcement officer, that people, because of the schedules and the demands, people become kind of only friends with other first responders, which is great. You know, we derive a lot of our sense of self-worth from the groups with which we affiliate. However, it can really kind of narrow your mindset of kind of the world and people.
And there's something
Kate,
really
were you gonna,
grounding about
yeah,
your non-first responder friends and family sometimes.
yep.
And they, at least in my experience, mine calls me out more than my first responder peers tend to. I have one question about the talking. Does recording a voice memo, if you can't find somebody you're comfortable talking to, does it have similar effects, or is this really where you need to be person to person?
You know, that is a really wonderful question. And I do not have an answer to that. I don't know if that would have the same kind of salutary benefits. Because, you know, even if over time as a first responder, you think maybe you don't like people as much as you like them at one point, we are still biologically driven to be social creatures. So I would anticipate that part of the salutary benefits of that is actually speaking the words kind of to another person. I'm not aware of whether or not there's any kind of salutary benefits of voice recording. That's a really great question. So somebody on this call do that research. Um, Kate volunteers. Okay, so the other is, of course, therapy, right? There's so much stigma around seeking support. But as a clinical psychologist and as a researcher who does evidence-based work for first responders and their families, I do work with PTSD, depression, anxiety. What I'm doing with folks is oftentimes very structured. It's time delimited. We're focusing on helping people resolve their symptoms and improve their lives. Um, the most common, like a typical client for me who stays and does a meaningful chunk of work, I usually meet with for anywhere between 10 and 20 times, right? This is not years and years and years of therapy. These are kind of structured, focused treatments that are very effective in getting people relief from symptoms. Okay. So again, I know that there's a long-standing history of, you know, I don't want to go to therapy, I don't need to go to therapy. Therapy is blah, blah, blah. But what we know is that the vast majority of people who seek out therapy benefit from it. It doesn't just have to be reactive, right? I've had a number of clients come to me and they're really looking to bolster preemptively their resilience strategies through therapy.
I love that. I would love my medic students and EMTs and the telecommunicator workforce and all of our first responder family to have an established and trusting relationship with a therapist before they need them. Because let me tell you,
Yep.
getting a really stubborn first responder to seek help when they really need it is hard to build that relationship.
It's really hard. And it's really hard when you're really struggling to have the time and motivation and energy to then go try to seek somebody out in the community, and especially seek someone out who understands first responder culture, right? So I can't tell you how many times I've worked with somebody and they come to my practice and they say something like, I'm just so grateful that you get it because my last therapist cried when I told them about my worst call. Or my therapist told me I should quit my job, but I love my job and I need this job. I don't want to quit my job. But my therapist basically just said, you shouldn't be doing this job anymore. And so finding somebody before there's a crisis who understands first responder culture is critical.
And it's not like one and done. It's, you know, when you walk into the shoe store, you don't buy the first pair of shoes and they fit perfectly and everything's hunky-dory. You might have to interact with a couple therapists, even culturally competent therapists, to find one
Yep.
that you really mesh with, right?
Yep, absolutely. And you might find a therapist that you feel gets you, but doesn't have that much experience with first responders, right? There's not like a just a huge plethora of psychologists out there who are, you know, really versed in working with first responders. It's that number is actually smaller than is desirable, right? So there might be lots of therapists out there who don't maybe have tons of experience with first responders, but are a really good fit for you. So, and I always tell people, you know, if you went to therapy and it didn't work, don't blame yourself, right? A lot of people internalize it as Therapy didn't work for me. Well, maybe your therapist didn't work for you. Just as like in life, there are some 911 telecommunicators who probably could see some improvement. So too with counselors, right? There are a lot of counselors out there working that may not be a good fit for you, any number of reasons. So critically important to kind of find these folks before there is a more urgent need. So if we could move on, I want to be mindful of time because if you guys couldn't tell, again, me and Kate could talk forever. But there's a number of organizational strategies that can be adopted to boost resilience among employees. Certainly, and I'm not just saying this because I doing training, but I truly believe in education, right? Training on mental health, training on stress, resilience strategies, avoidance. So in 2019 in the state of Illinois, I was awarded a grant through the state to develop 2-day training on PTSD, suicide, resilience, and peer support for law enforcement. And then me and my co-presenter, who's also now my husband, went around and we did this to like 25 different groups of police officers across the state. And very quickly, I can't tell you how many folks came up to us and they said, I wish I had had this in the police academy, right? Had I known from the start in the police academy or within my first year how avoidance and suppression and how some of these coping strategies that I started rigidly using would contribute to the way that I'm suffering now, things would have been different for me, right? Training is so incredibly important. Another is organizational assessment. So, and I'm not saying this just because I do this, but it can be profoundly useful. So I've worked with a number of 911 organizations that are struggling in any number of ways, whether or not that's understaffing or they're having interpersonal issues or whatever the issues are. An organizational assessment where you have somebody come in with well-validated, clear measures to assess what is going on here can be incredibly invaluable. And I'm telling you, sometimes you'd be surprised. So sometimes I'll go to an agency and we'll do an organizational assessment based again on kind of validated and normed measures, and then the experience that I have. And we find kind of what we thought we might find, right? Other times I've gone into organizations and they think that problem's over here, right? But in fact, it's the problem is that there's tension among the supervision team or tension between the supervision team and the frontline folks, or sometimes there's relational aggression that has been allowed to persist that has gotten out of control. Sometimes there's things like social loafing. Anyway, all I'm saying is that there's a lot of different ways in which organizations can be struggling. And sometimes a good organizational assessment is a wonderful first step to figure out where should we be targeting our resources, right? Resources are not always in abundance. And so if you do a good, clear organizational assessment, it can really help you direct those resources to where they're most needed. Sometimes critical conversations and interventions, right? So I'm working with an agency right now that they're having a shift where there's some interpersonal tension and it's really bringing people down, right? So having somebody from the, often from the outside, but if there's somebody from the inside who can do it, sitting people down and having these critical conversations, right? We can't allow these things to persist and lead to kind of hostile or toxic work environments without doing something about it. Those problems almost inevitably will get worse with time as opposed to better if something's not done. Having psych either on staff or having retainers. So here in the state of Illinois, I've seen more and more agencies moving out of, for example, formalized EAP system, which again, I am not, trust me, I'm not saying anything negative about EAPs. However, I work with a number of organizations where management has hired me to provide a certain number of sessions per month of counseling to their employees. And the only information that they get is on a quarterly or bi-quarterly basis. All they get is a report of how many of those sessions are being used. They don't know dates, they don't know people, they don't know topics, they know nothing about what is being discussed. All they know is if the sessions are being used. And then that can, for their kind of planning and budgetary reasons, can be important to them. And in fact, I've never had one of these agencies come to me and start asking about employees because they want it to be confidential. You don't necessarily want to know, right? You just want to get people the resources that they need. And so I have a number of these retainers where employees can literally just reach out to me directly and the employer never really knows anything that we're talking about. and people feel, we think, that this is a great, confidential, and easily accessible way to get the help that they need. We need to start getting creative, right? I mean, the extent of understaffing is, whew, it's overwhelming. So the extent to which we can start thinking outside of the box in terms of staffing, schedule, seniority, right? I've seen a lot of people start leveraging and using part-time employees in ways that are really helpful, or job sharing, right? There's a lot of ways in which municipalities, cities, departments feel like, well, this is the way we've done it, and we're just going to keep doing it this way, right? That there are some creative solutions out there that can really, on an organizational level, increase employee satisfaction and organizational resilience. Peer support training and programming is critical. As Kate said, it can be really hard to find the time, resources, energy to go get therapy, right? But peers are right there, right? I believe fully in the power of peer support. And in fact, I collected data, which I'm in the process of trying to write up for publication. And simply having a formal peer support program in your agency increased employee satisfaction, reduced risk for PTSD, depression, anxiety, turnover intention, increased job satisfaction. So support matters. Being in organizations where people feel supported by their peers, formally and informally, is critical. We're also going to hear about dogs and quiet rooms here pretty soon, and I'm really excited to hear about those things as well. So, it is resilience is not something that most people, most organizations just fall into. It requires proactive, intentional steps to bolster one's resilience.
And this is all forms of prevention,
Yeah.
really. And one of the things, so I come from a public health perspective, but I also been a first responder for 26 years, and we're losing too many good people who are leaving the field or are struggling with a diagnosis, or God forbid, we are losing them to suicide. And so much of my work is, how do we actively get upstream and do this prevention? And there are some really low hanging fruit of active strategies to help our workforce. And then there's the more complicated, more challenging things. But I love what you said about really looking at the organizational assessment. And there was a national survey of first responders that one of the things it found, there were reasons for why people didn't seek help. One was, I didn't have time. They didn't prioritize themselves. But then also, when they were talking about the different stressors that were contributing to their issues, interactions with peers, interactions and conflict in the workplace setting was a really big one. And this is something where I think sometimes we don't think that we can resolve these things. And it just takes the effort and the culture in the organization to face it head on and work towards resolving those challenges.
Yep, absolutely. Absolutely.
Yeah,
we need to be, this is about prevention, right? Unfortunately, sometimes when we're waiting for, pardon my French, but for shit to hit the fan to react, we're already putting ourselves far behind the starting line in terms of trying to safeguard our most valuable commodity, which is people.
Yeah, I think as we go to the next slide, I want to preface it with, I do a lot of work on suicide prevention. I have lost 11 of my peers, people that I worked directly with on apparatus or in the station in the last 26 years, to suicide. And so I have had a passion for doing more research to better understand the conditions, the risk factors, and what contributes to suicide among first responders, including the EMS and 911 workforce. And the paper that we published this past spring with NIOSH and CDC colleagues, it really does show that we have an increased risk within first responder populations. But that's not the end of the story. Because we have an increased risk, we need to be doing more for prevention. We need to be understanding what creates that risk, and we need to be able to have those upstream interventions that help protect our workforce, our most valuable people. We're already short-staffed. We can't afford to lose any more of our workforce, and we want to actually recruit and retain and really increase the size of our workforce. So what can we do in terms of a prevention mindset to go upstream and help our workforce? But also, it's really, really critical to have a plan for empowering your people whether it's within your peer support team or it's any and everybody who works your 911 center, from the people who are on the floor, the people who are supervising, to the security officer at the front door. Everybody in your center needs to be empowered to also recognize when a peer or a supervisor or a medical director is different and acting different, and having a plan for if you actually need an intervention for an employee in crisis. Having this planned out and knowing how you're going to do an intervention, what resources are available within your agency, within your community, within your healthcare system and behavioral health system is really important, because if you've empowered your people and they get to the point where they recognize that person and they ask them the difficult questions and they find out that not only are they struggling, but they have a plan and they have lethal means, that's a moment in time where you can make a life-saving change and help that person. So having a plan ahead of time in any first responder organization, I think, is incredibly important. The reason I do this work is I lost a telecommunicator in 2010. He died by suicide, and the last person who saw him besides myself was the security officer. And it was very atypical for him to be in the center at the time that he was there. And so there are ways that empowering people is important. We are not going to stop every single one of these. We are going to have instances where we lose first responders who die by suicide. Having a plan for postvention is also incredibly important, because when you survive and you have a peer who's died by suicide, you're at increased risk. So empowering your organization by having a plan ahead of time to protect the survivors, to protect those who are impacted. In most suicide prevention research, we think about, for every suicide, approximately 6 people are impacted. I would argue that that's significantly higher in first responder populations. So I would sort of look at more, instead of 6, I think of more like 36 when you're looking at a first responder. And because you have that first responder family as well as their family. So really having plans in place for prevention, intervention, and postvention will empower your agency to be better prepared should you have a crisis, should you have somebody who dies by suicide. And then I can't say this enough, going and building that relationship with a therapist before you actually need it, and having that built trust, it can be incredibly helpful for a lot of people in our population. But there are challenges. It can be expensive. There is not enough clinicians in our communities to provide the service. So then also knowing what resources are available in your community is pretty important. Next slide, please. So I am not endorsing any of these resources. I'm a federal employee. I do not endorse resources. However, I think it's really important that every agency knows what resources are available in my agency, in my county, in my department, in my community. Everybody across the country has access to the Disaster Distress Helpline, as well as the National Suicide Prevention Lifeline, or 988. But there are other resources. There are ways that you can do some basic education for free. There are ways that you can use apps. The VA and their National Center for PTSD has a whole bunch of apps that are evidence-based and vetted. There are things where you can do resources like yoga for first responder. There's so much stuff out there, but it's kind of overwhelming because there's just so much, and everybody wants to sell you something to help you with your mental health and wellness. And it's almost like getting into the wellness industry, where it's like, what is the latest fad? What is the latest thing that we can sell you to take care of your people? So I think it's really important that as you're trying to identify resources, leverage the resources in our community. Dr. Lilly is a fabulous resource. Ask your peers, what are their favorite resources? What is the evidence that they're based upon? Do they protect the data of your individuals if it's something where they're going to be using any personal data? And how do you choose them? How much money do we need to invest in this prevention and proactive intervention for our people, which is our most valuable resource in our 911 center? And how can we really invest in our people? So I wish I had more answers. My office is currently funding a research project. We're doing a literature survey right now. It's part of a 3-step modality we do for EMS evidence-based guidelines to talk about how to practice patient care. I'm trying to use that modality to give us an evidence-based guideline for how we should take care of the mental health of our workforce. Like, what does the research currently say is effective, and where are our big gaps in research? Next slide, please. And here is where I need everybody on this call to take a moment. We need more participation in research. When Dr. Lilly is doing research, we need all the possible people to participate in her research. We want her data analyst team to be overwhelmed with results and data to be able to really better understand our workforce and be able to generalize to our workforce population or the general population. If you can partner and do research within your agency, within your state, within the 911 community, when you're sent one of those surveys, if you can help that PhD student, if you can help that grad student, if you can help that researcher with their surveys, really take the time and participate. The more we improve our understanding of risk and protective factors, the more we can do evidence-based interventions and protect our people. So I'm going to get off my soapbox and see if Michelle has anything to add.
No, I would fully encourage you to remain on that soapbox for a while. Yeah, no, you were like speaking my love language, which is research. At the heart of all of this, I am a data geek. And I think for me, probably one of the most personally and professionally rewarding experiences of my life have been receiving messages where people say, I used your research and your numbers to argue for job reclassification in my state, right?
Yeah.
That kind of stuff cannot happen. We cannot direct resources. We cannot argue for more resources unless we really have solid data supporting it. So, I am constantly begging people to participate in my research. I realize that it gets old, it gets annoying, but it truly is critical for us to make change.
Thank you so much. And I'm just entering into the research space, so I will be learning from Dr. Lilly and her research as I work on my doctoral research. But I have been talking with NIMH and with NIH, and in the federal space, we are working on increasing the ability to fund research, specifically looking at our workforce and talking with NIOSH and other colleagues. And I think it's really important that as we advocate for them to do more research, we are going to depend upon all of you to participate in it and be able to help us better understand how do we make it so you thrive, so that you get to do the job you love to do. You get to do the job where you keep paramedics like myself safe. I have had telecommunicators save my life more than once in the past, and you're absolutely critical to the function of all first responders. So I think the first responders, we need to understand better how to take better care of all of you. And we need that advocacy in government, local, state, and federal to make sure that you're getting the resources that you desperately need. So next slide, please. My contact information's here, and if we go to the next slide, Dr. Lilly's contact information is there, and we knew we were going to run late in terms of speaking, right? There are over 35 questions that have been asked. I promise you, we are going to take those questions and we are going to run with them and form some responses to be posted. But I don't want to shortchange the second half of the webinar, as they're going to talk to us about their quiet room and their dogs and all they've done at their PSAP. So I think it's really important to give time. So I'm going to pick 2 questions and we're going to try and squeeze them in. Is that okay, Michelle?
Yeah, I will be
All right.
I will be fast. I promise. I won't pull a Michelle Lilly on you and give you a 7-minute response.
Do you have one that you specifically want to answer first?
Well, you told me not to be looking at the
Okay,
Q&A,
good.
so I
I
haven't
got
been
you.
looking at it.
All right. So has anyone explored the effects of culture on mental health in 911 and the compounding effects of professional stress with this intangible stressor?
Yeah, I think, yes, certainly some, right? So I published a study with Kim Turner where we looked at some kind of cultural questions like, work-life balance and like work conditions and whether or not that interacted with things like mental health predict stress outcomes. That was one paper. It's really actually hard to study culture because that means a lot of different things and it can be indicated by a number of different things. And so I don't know that there's a lot of research out there. I do know that, for example, Adam Tim has done some qualitative work in that area, kind of looking at kind of culture and leadership and the impacts of that. So, but I don't know of much kind of quantitative research on it. So I think it's a really great question. I actually do have developed a standardized measure called the problematic workplace questionnaire, which I validated with 911. So I actually have some data on it, but I have not yet really kind of looked through some of that data. So Kate, can I actually like pick one of these questions? So that
Of
was the
course.
first question, but I like one of these other questions. But I got to get permission to
Oh,
go. Yeah.
go.
So the other quick question that I saw in here that I wanted to address, somebody asked, how do you get people to talk, right? There's such concern about confidentiality. There's so much question about stigma. There's worry about, if my department is hiring you, how do I know that what I'm telling you is confidential? And what I will tell you is that sometimes it takes time, right? But don't give up. So I've had retainers with a number of different organizations where for the first 2 or 3 months, literally nobody came and talked to me. But then I went and I did sit-alongs, and I sat, and I talked to people, and slowly people started coming in and talking to me. And then I got with some agencies, I kind of got a little inundated, right? Once people start talking, once one person breaks frame and has the bravery to step up and talk and then share that experience with their coworkers, it literally opens the floodgates. So actually just yesterday, I was at a police department that had a critical incident last week, and I went in and we didn't do a formal debriefing, but I just sat, and the people who were on scene kind of came in and we just did like mini check-in. Some of it was like, oh, hey, you're wearing a golf shirt. Do you like golf? And I was like, yeah, I love to golf. And we talked about golf, and I'm like, how have you been in the last week? And then they say, I'm doing okay, but blah, blah, blah. Right. And I said, give me just reach out. Right. And so those opportunities to kind of sit and talk are critical. And that organization that has had variable usage of kind of the retainer in the last 24 hours, it took 4 people reach out to me. So I will say that it takes persistence. It takes being on the floor. It takes making a personal connection. And it often takes one or two brave people within the organization to trust it. And it takes somebody, if you do retain somebody who your admin or management can't bully into giving them information. So I did drop one organization because we had a retainer. They kept asking me questions that I felt could identify who was using the services. And I told them that while I loved working with them and I love their people, that I did not feel comfortable working with them anymore. So it is hard to balance. It's hard to get traction, but once it's there, it is incredibly powerful.
That's an awesome answer. I believe we have one person with their hand up. Do you want
Unless you're muted.
Yeah, can we unmute Celeste and see what their question is?
I believe she's, there you go.
I didn't have my hand up, I'm sorry.
Okay, there we go.
She's giving us a high five.
That's awesome. So here's the really, we have so many great questions, and there's so much that I think Michelle and I both have to say for all these questions. So I'm gonna work with Michelle, and we will work on really answering a lot of these questions to try and get you that information and posting the answers on 911.gov. So I am so sorry that we did not get to all of the fabulous questions, but there are some really great questions in here, and we will make sure to get them posted with the webinar. But I do want to make sure that I'm respectful for the next hour's presenters. And if we finish up a little bit early, maybe we can circle back to some of these questions at the very end if Michelle's willing to stay on with us. So thank you so much for this discussion, Michelle. It is always fabulous to hear your perspective, and really the whole community owes you for the pioneering research to really get that foundational research, which I've used repeatedly in my job in advocating for the 911 community. So thank you for that. So although we moved pretty quickly through our question and answers, I want to make sure that we have enough time for our next presenters. So Reagan Porter and Ray Lee from FGM Architects will discuss the benefit of quiet rooms in PSAPs. And we will also hear from Martin Bennett, the Director of Cook County 911, and Megan Kinsella, Director of Operations Cook County 911, and K9 Joey's handler, about their programs.
Good afternoon, everyone. I'm Martin Bennett. Go ahead to the next slide, please. So just to give you some background information about our center, because I know a number of you are probably curious as to how large we are in the makeup of our center. So we have 112 current employees. We're a police-only dispatch center with 16 agencies. Our service population is 280,000 residents, and our call volume, we do more or less a lot of incoming, outgoing phone calls, because we are Cook County, which Chicago is in Cook County, so we have a very large jail. We have a lot of services that we get calls because we're the 24-hour number for people that are calling for county services sometimes. So we do have a high volume of calls that are coming in, 704,000 that we had last year, with 220,000 of those being 911 calls. So some of the unique items for our department is the sheriff's police. We have our patrol units, but then we have a lot of ancillary units like our bomb squad, special operations, vice, crime scene investigators, special victims units. A lot of these officers spend time in the incorporated areas of the county, and we also spend a tremendous amount of time inside the city of Chicago too. So there is a lot that the sheriff's police is doing in and out of the city of Chicago. And then some information about our jail that we handle, 7,347 people in jail, with 1,825 of them being on electronic monitoring. So the 911 center does deal with electronic monitoring on a regular basis, because we end up dispatching the sheriff's unit to electronic monitoring violations. And then we also monitor our officers when they put people on electronic monitoring, which is done on a 24/7 basis. We have a forest preserve police department that covers 70,000 acres of forest preserves in Cook County. There's over 100 forest preserves. And then we also dispatch for the Metro Police Department. So that is a railroad police department. It's a very complex system. 242 stations on 11 lines that all originate from the city of Chicago and go out from there. So our coverage area for that goes into 6 counties in Illinois, and also as far north as Kenosha County, Wisconsin. Next slide, please. So just to give you an idea, in Illinois, we had a lot of consolidations that took place. So we were one of the agencies where we were consolidating other agencies. So 2014 is when I started taking over for operations. You know, we were about a mid-size agency with 4 radio bands, 36 telecommunicators, and 46 total employees. We mainly just handled the sheriff of Cook County. We didn't really handle any outside agencies. Fast forward to where we are today with the 280,000 people. We're now operating 13 radio bands. We have 88 telecommunicators and 6 call takers, and we have 112 employees. In addition to the police department items that we're handling, we're also the central repository for fugitive warrants that is handled out of the 911 center too. Where we're going in late 2024, we're continuing to do consolidations. Service populations going to 350,000 residents. We'll have 14 radio bands, 97 telecommunicators, 21 call takers, and 140 total employees. Next slide, please. So our center management, this is something we pride ourselves on. Everybody started as a telecommunicator. So every single person, including myself, all sat, you know, on the floor, working doubles, having to work mandated overtime. We've all dealt with that at one time or another, including our supervisors too. We don't really see how we can promote people to supervisors unless they have a thorough knowledge of our operations on the floor. Next slide, please. So some of the issues that we identified with our center as we saw this rapid growth was our existing footprint that we had in the center. We had acquired additional space. A lot of complaints from TCs about the break room kitchen area. You know, we all like to bring in food, have those items there. There's nowhere to prep anything or do anything. Day shift employee, we have a lot of administrative staff that's working, so over 30 people working at one time. Very difficult when everybody's crowded into a small space. Our floor in the kitchen were located right next to each other. And I've seen this in other centers too, where you're constantly hearing radio traffic and phones ringing. Same thing with our existing quiet room. We had one, it was an office with a couch. It was a spot that only one person can occupy, but then it was populated in a hallway where there was a bunch of other offices on day shift. So it was very loud and hard to focus on decompressing and getting rest. Inside of the 911 center, we had several heating and cooling issues. We were either too hot or too cold. There was no middle. And then we have a shared workout area, shared gym area with the Illinois State Police. But we didn't have access to showers. So people would say, you know, oh, I would like to work out before work, or I'd like to work out after work, but it would be nice to have an area, you know, where I can shower. Next slide, please. So some of the things that when we were researching and learning more about the quiet rooms is that the employees need a space where they can go, where they can decompress, and it is quiet, and they're not hearing all of these external things going on, and they want to be able to relax. The rest in between shifts, so a lot of people double back for shifts. We would find that when people were doubling back, they maybe get 4 to 5 hours of sleep before starting another shift, because the commute back and forth to work, sometimes they're picking up kids or dropping kids off. And so really, once people start working a couple doubles in a row, you can really see that wearing on them. We found now that with our quiet rooms, people can get a solid 8 hours in between shifts where they can get rest, and that really works out well for them. We had a rough design of what we wanted to do. We knew we wanted to do 4 quiet rooms with 4 showers in each quiet room. Traditionally, we only have 2 people on break at one time, but what we thought was we might have someone coming in early or someone staying over late. So 4 quiet rooms was kind of what we wanted to do. We knew about FGM. I had met FGM at one of our conferences, and I had talked to them. They specialized in municipal contracts, and it was one of those things that when we were introduced to them, started talking to them about design and space use. So I started talking with Reagan, and then I started learning about things like light therapy. We did surveys for existing employees. So we wanted the employees to take surveys before we did anything, to ask them things like, you know, do you feel you have a quiet space? How is the lighting in the center? How's the temperature? Important things that we wanted to know. Reagan introduced me to Dr. Joel Robertson regarding brain health and long-term impacts. So one of the things that we learned was about always constantly being on and always being connected to technology, that is not a good thing at all. We started a Protective Protectors program through Dr. Joel Robertson and the Robinson Brain Health Institute. I would recommend that you check that website and watch some of the videos on there, seeing what happens to you when you don't take time to decompress and to be in a quiet room and to separate yourself from all the noise and everything at work or at home. The statistics are staggering on that. Next slide, please.
All right. Yeah, thanks, Marty. I'm going to try to run through this as quickly as possible to give you all the information, but then leave time for questions and so that Megan can talk about all the exciting things she has to talk about. So you guys we've talked about the different stressors. One thing and we've talked about this too a little bit, is that or stress is unique to each individual, right? So what is going to help de-stress you is also going to be somewhat unique to each individual as well. I specialize in municipal interior design, and I have a big passion for, what we can do in the interior space to help you reduce your stress. So we partnered with Dr. Joel. Some of the things in partnering with Dr. Joel and some of the research that we have done is obviously there are these long-term effects, depression, anxiety, burnout, PTSD, suicide, and there's even more things. So next slide. It's not a new concept that your built environment has a direct impact on you. So we looked at different ways that we can start to mold the environment to help reduce stress. Next slide. I'm not going to get into all the different chemicals, but I think the one thing to just note quickly is that throughout the day, the chemicals in your brain are fluctuating, right? From the different stressors that you're under and being on all the time. And what the goal is to try to balance out those chemicals. Next slide. So one thing with the chemicals in your brain, since you're on all the time, you're also getting hits of dopamine or those stress hormones in your brain when you have these calls come in all day long. So it's repeated that you are on all the time. What that does is it starts to affect your moods and behaviors. And with the increase of dopamine, it drops your acetylcholine, which then in the future is linked to early onset Alzheimer's. So knowing that this is really important, we started to look at what we can do in the built environment. Next slide. The easiest way to kind of boil this down is to play on all of your different 5 senses. Next slide. So we know that color affects us, right? We know that red is energetic, yellow is joyful, purple is more meditative, blue is more peaceful. So all these different colors can be used in different ways. That is affecting or coming through our sight through that sense. It can be done through paint. It can be done through sound panels or colored light even. Next slide. Through sight, there's also biophilia. So biophilia is linking us back to nature, right? And that can be done through textures, patterns on the wall and the carpet. So that feeling of nature, right, is very grounding to us. So when we can introduce those patterns, it has a grounding effect on us. Next slide. We also know that through sound, we can listen to different playlists or the Calm app or nature sounds, which have a calming effect on us. Dr. Joel Robertson actually on Spotify has created different playlists. So you've got serotonin drip and dopamine drip. Let's say that I want to calm myself down. I can go in or start to listen to the serotonin drip, and that's going to be less beats per minute, and it's actually going to have a very calming effect on me. On the flip side, let's say I am coming in and I had a fight with my partner, or I'm just really worn out and I need to get some more energy. I could listen to the dopamine drip, which is going to have more beats per minute, which is going to energize me, make me more creative, have those kinds of effects on me. Next slide. The other thing, which is scent. This can be this can be overwhelming to different people. So if you're going to use a scent, I would say that it is in a well-ventilated space, or maybe is an essential oil that you put on your wrists. We know that lavender is very calming. We know that lemon is uplifting. If you are, and we'll get to it in a minute, but in some of the rooms where there is attention restoration, you know, if you're using that power of awe, you're trying to immerse yourself into maybe nature, maybe you've got juniper or more of a woodsy scent. So you can use these different scents, you know, to help have a calming or more energizing effect on you. Next slide. Some things that we often forget about are so simple, but you know, the furniture we put in a quiet room or in a space, if it has more of like the rocking chair on the left, that can have a very calming effect on us. The bottom two images where you see the textures, one has a little bit more of a grass or a pebbly texture. That's that biophilia, the textures within a space. Weighted blankets or more chunky blankets can be calming. And then on the flip side, if we want to energize ourselves, you know, there are different furniture pieces that actually have movement, like those little hockey stools in the top right, creating movement, blood flow, all of that will help with energizing us and creativity. Next slide. So we also know through taste that what we put in our body has a direct impact on our brain chemicals and how we feel. So really eating all of those colors from the rainbow, trying to be as healthy as possible with what we put in our body, and drinking enough water is important. Next slide. Okay, so just a couple more de-stressors that I want to go into. Next slide. That can be integrated into the built environment. So we know that lighting zones can be really important. Also, circadian rhythm, which I'll talk more about in a minute. HVAC controls, sometimes even you can have different kind of controls through a raised floor system for each individual dispatcher. And then being mindful of just furniture economics, as well as just another important thing would be warranties on your furniture, which will help you in the long run. Next slide. Okay, circadian rhythm. So Dr. Lilly talked about how sleep is so important. We know that the sun helps us keep our circadian rhythm in balance. So that's done through, you know, when the sun rises, it's a little bit more of a warmer temperature, color temperature. Through the afternoon, it's a more of a cool blue temperature. And then sunset and evening, as the sun goes down, it gets warmer again. Well, you can integrate that into your light. The other thing that they've done is they've linked the sunlight to a wavelength, which is 490 nanometers. And when you include that into your light, it can help, like, especially when you have a dispatch center where you don't have a lot of natural light, you can integrate that in so that it helps with your circadian rhythm and your sleep overall. So next slide. Again, just physical activity. Marty talked about how they share a workout room with the state police, which is important. Next slide. And then anytime, you know, we think of like these one areas, but even if we remember, you know, these different areas, when you come in, anything that you can do to kind of bring you back to that biophilia or give you just a moment of relief in a different environment. Next slide. Quickly, the power of awe is the one emotion that is linked to lowering pro-inflammatory ketones in your body and helping reduce stress. So it could be done through, and the power of awe is really when you're, the the easiest way to think about it is when you're in nature and you see something, you're in awe of it, right? So that can be integrated through large graphics. It can be integrated through sound panels. There's a lot of different ways. It could just even be a TV with scrolling images to get that effect. So that is something that we try to incorporate into different quiet rooms. Next slide. So we took all this information and really wanted to immerse you into playing on all different 5 senses in one space. So I love the image on the left to kind of give you that sense. And then you can see on the right, that's actually an image of a very early design that we use in a lot of our presentations to kind of give this full concept. Next slide. I'm going to come back to this in a minute with the quiet rooms that we developed for Cook County. So this is the plan that we developed. So you can see the communication dispatch floor is here, and our quiet rooms are here. We've got 4 different quiet rooms off of a corridor. Next slide. Okay, so the first 2 quiet rooms are based on the color and light and sound kind of therapy. So there's actually sound that is, you can go in here, you can link up, your Spotify or your Calm app or anything like that, and it will actually play those sounds within the room. And then the colored light that you see here will change to, if you link it to the dopamine drip, it's going to move a little bit faster, a little bit brighter. And if you link it to the serotonin, it's going to be a little bit dimmer and move a little bit slower. And then these lights that are in the top also, they kind of do like a dancing motion if it is on the dopamine, if you're on the dopamine kind of sound link. And then if you are linked to the serotonin, it's just a little bit quieter and dimmer. The other things in this room that you'll notice are the textures on the wall and the floor. You'll notice the chaise lounge here that they can, you can, sleep, or if you want to come in here and meditate during the day. The other things to point out, so Marty mentioned that their old quiet room was off of a corridor where offices are. What you'll notice here is that this corridor has only the 4 quiet rooms with the changing and shower rooms off of each one individually. The other thing you'll notice is that these walls here are actually double studded walls that go up to the deck, which really helps with sound. So when you're in this room and the sound is on, like if I'm playing music or Calm app or whatever, you can turn it pretty loud and you cannot hear it out here in the corridor. So that double studded wall really helps with that sound, containing that sound. And then there's also seals on the doors as well. So next slide. The next 2 rooms are really based on that power of awe and that attention restoration. So taking yourself again away from, that technology and being on all the time. You've got a sound panel on the wall here that is also helping with sound absorption. And then you have more of a wood texture for that nature and biophilia element on the wall. We've got a green color, and then we've got the texture on the floor. The other thing is that this chair here actually has a rocking motion to it. It's really a rocking chair. So if you want to come in here and kind of meditate or just take a minute away, or even if you're sleeping, this is, really just to kind of remove yourself and gives you that calming effect. Next slide. So this I'm going to leave up for a quick minute. Marty, there was a spotlight on ABC where if you take this QR code, click it, it'll actually give you a short video of the quiet rooms and the light changing. So that's something to really kind of see it live and in action. Next slide. And again, just creating those different awe-inspiring spaces or moments throughout the facility. You know, we do the quiet rooms, but you know, if you can incorporate it in a lobby or a break room or anything like that, those are all equally important spaces. Next slide. Another piece of this is, so this is actually the kind of lobby reception area. You'll notice there is the biophilia with the different textures, but the other thing that's really important that we found to be integrated is branding. It gives everybody really a sense of place and ownership, and really makes them kind of feel at home in the space. So you've got the logo on the back, but then you also have a quote for the gold line on the right hand side. Next slide. The other thing that this branding helps with too is recruitment and retention. This is the break room. So another thing, you know, as we're helping to reduce stress, not to be forgotten are the community spaces where you can come and really be engaged with one another. Or if you want to be in a space with people, but really kind of, you know, have more of be separated from the action too. This room allows that as well. There's a TV on the wall over here, and then you've got this more lounge set up to the right with two of the rocking chairs. The chairs are a little bit higher to the back and kind of almost hug you if to give you that warm kind of comforting feeling as you sit there. But then you've also got the stools at the countertop and even tables and chairs around. So it really gives a lot of different spaces within a space. Next slide. You'll also notice in this room all of the different textures that are brought in, as well as these are sound panels as well. So really within each space, taking into account the sound as well. I ran through that really quickly, but I want to leave time for Megan and questions. So Megan, I am going to turn it over to you.
Thanks, Reagan. So my name is Megan Kinsella, and I'm the operations director here at the 911 Center. I'm also the handler for our new therapy dog. As you can see from this first slide, it was pretty typical for us to have therapy dogs come through the center periodically. If there was a large scale or a traumatic event, we would have them come in. We also just had them come in on random days. We would schedule them ahead of time. Next slide. This is just another picture of a couple of the other dogs that would come in to visit. So we would use private organizations and schedule the dogs to come in throughout the day. So they would come in and visit with the dispatchers, spend a little bit of time here in the center for the dispatchers to kind of decompress. Next slide, please. This is the department's therapy dog, Zilly. So Zilly works with the sheriff's office, part of the canine team. And Officer Roman is her handler, or his handler, sorry. So he brings Zilly out to different events. He'll go to different community events. He'll visit, the pediatric ward at hospitals. He works directly with the state's attorney's office. If they're interviewing children or young kids, he'll bring Zilly in to sit with them while they conduct the interviews. If they have to testify in court, he'll bring the dog in to sit with them, while they're in court. His wife is also a dispatcher here. So he understands the stress that the dispatchers are under. So he would periodically bring Zilly up here to visit. Anytime that there was any traumatic events that he knew of, he would always, show up with them, just walk around, sit with the dispatchers. And then throughout the day, throughout his shift, throughout their weeks, he would come in, just randomly stop in and say hi. And you can visibly notice a difference when he walks into the room with the dog, that just the whole stress level kind of comes down a little bit. Next slide, please. So Tales of Redemption is a program at the Cook County Jail in which the individuals in custody work with shelter dogs. They do basic obedience training. They learn to groom them. They get the dogs used to walking on leashes. So they're pulled from shelters and they spend time at the jail with the inmates training them. And then when they're ready for adoption, the sheriff's office sponsors the adoptions. So Officer Roman works closely with Tales of Redemption. And he pulls a lot of the dogs from local shelters that he thinks would be good for the program. Next slide, please. So Joey was one of the dogs that was turned into a local shelter, and Officer Roman pulled him initially for the Tales of Redemption program. He started working with Joey and would bring him up to the 911 center as part of his training and part of his socialization. And he realized pretty quickly that Joey had something a little bit special, that some of the other dogs that he had been working with didn't really have this, really outgoing personality right away. And Joey's main focus is people petting him. He wants to be the center of attention. He wants someone touching him all the time. So he would start bringing Joey out with Zilly to different events. He went to a lot of the different police districts for roll calls. He would come into the 911 center, brought him to the hospitals, had brought him to some first responder events. And Joey really was excelled at being around people. So next slide, please. Officer Roman decided that he knew that we were looking for a therapy dog for the center. We had looked into purchasing one. We had looked into adopting, but he realized, pretty quickly that Joey would be the perfect dog for the 911 center. So he started bringing him up here. I started working with him, training with him, and then I actually formally adopted Joey from the shelter. And he's part of the canine unit. However, there's an MOU that establishes his role here. So the MOU defines what my role is, that I'm his owner. He can't be reassigned to a different unit or given away to a different handler. However, he falls under the department for training, for all of his certifications. I work with Officer Roman pretty closely, where he's training me on, how to work with the dog, how to socialize him, how to bring him into different situations. Right after he turned 1 is when we formally adopted him. So he's been at the center with me now. He comes in every day and he's here probably about 8-9 hours a day. So the day shift and the afternoon shift get to see him every day. And then there's days where I'll come in late or start early, so the midnight shift gets to see him. Next slide, please. So once we adopted Joey, our social media accounts featured him, and Fox News decided to do a story on him. So they came out, interviewed Officer Roman, interviewed some of the dispatchers about the impact of having him in the center. And then they also, after the interview was on, then they invited him back to be on the morning show the following week. So that was nice for the dispatchers to get some sort of recognition, because they talked a lot about Joey's role in the center and why it was important that he was here, what services he offered to the dispatchers, and kind of acknowledged, what they're going through every day during an 8-hour shift, the different stuff that they're experiencing, that the dog kind of offsets some of the stress that they're feeling just by walking through the room. Next slide, please. So this is Joey's badge for work. So currently we're getting a few different certifications for Joey. He has a Canine Good Citizen degree and advanced degree through the AKC, which is like a basic training and like a basic level dog training. And then we're working on being certified as a therapy team through Brevard County Sheriff's Office Paws and Stripes Comfort Dog Program, which Officer Roman and a couple other our officers are training us in. So we go to different events, like we'll meet the other Zilly, the other comfort dog, at different events. We've gone to a couple different hospitals. We'll walk through the courthouses with them. So we bring him out just to socialize him, so he's not just in the 911 center. Next slide, please. But when Joey's here, he kind of splits his time between the offices and just walking around on the floor. Like today we came in and he took off, and I haven't seen him in probably 2 hours. Every once in a while he walks past my office, but he's out on the floor playing with the dispatchers. He'll bring his toys out there. He'll just sit and let them pet him. When they take breaks, they'll take him for walks. They take their lunch, they might walk across the hall with them, bring them into the lunchroom. But basically, he just kind of walks around the floor and visits with different people throughout their shifts. And when he walks in the room, you can tell, there's a physical reaction that people have when they see him. A lot of times they're tense, they're kind of leaned over their computers, they're taking call after call after call, and he'll walk up and you can kind of see them just relax. They'll acknowledge that he's there, they'll just pet him, and he'll just sit there and let them play with him while they're continuing to talk on the phone or talking on the radio. They're dispatching or call taking while they're playing with him, or just having him sitting there with them. They kind of smile when they see him, and it kind of just shifts the whole atmosphere in the room, during just a regular shift, and definitely during like high stress things. Next slide, please. So these are just a couple of pictures of Joey interacting with the dispatchers. He'll sit out there and just watch what they're doing. Typically he's pretty quiet. He goes along with whatever they want him to do. If somebody grabs him and needs to pull him away because someone gets busy, he'll just kind of wander over to the next person. We're working on making sure that he's quiet and kind of not getting too rambunctious, because he is still a puppy, so he does get excited sometimes. But that's one of the big focuses that we're working on with him now. But he's even after him being here for a couple of weeks, you can tell that he's now more acclimated to the environment, and he kind of takes cues from the dispatchers when it's playtime, when it's time just to sit and watch what they're doing, when it's time for them to pet him. So him being here every day has really just changed the dynamics of the whole room. And it's really given the dispatchers the opportunity to kind of take a break from what they're doing, but while they're still sitting at their positions and working. So that's about all I have about Joey. I think the next slide is probably our last. If you want to go to the last slide.
Excellent. So this is our time. Thank you so much for your presentation. This is our time to do the question and answers, and we have some time to do question and answers. So thank you, Marty, Megan, Reagan, and Ray for your wonderful presentation. As a reminder, to ask a question, please use the Zoom question and answer feature located in the bottom of your screen, or press the raised hand button so that we can unmute your phone line. So the first question that I am seeing is an ask to share the MOU about Joey. So if you guys are able to share when we post the webinar on 911.gov, do you think we could share a copy of a sample of what an MOU for a dog would look like?
Sure, we definitely can.
Awesome. So anybody have a question, want to raise their hand or add questions into the question and answer section?
So, Kate, you might not be able to see them, but there's another question that I think is a good one, and I hear this frequently. How do you address issues with people who have allergies to animals, or who just aren't dog people, which I can't imagine, but I think they're out there?
So we initially, when we first started bringing therapy dogs into the center, we had asked everybody in the room, is there anyone who just has an aversion to dogs, allergic to dogs, just isn't interested in them being around? So we would plan it around when they were here, when we had dogs coming in. So now with Joey, we kind of follow the same lead. So he's always on his leash. If I'm not out on the floor with him, I'll hand him to a dispatcher, and that's the person that's kind of in charge of him that, for that time that he's out there. There's the dispatchers since COVID now typically sit at the same positions. So the people that are not interested in them, the people that are allergic to them, are kind of in that same area. So we know not to walk over into that area. So it's more of you have to be mindful of who's working, where they're sitting. We don't just let him have free range and run around the entire room without somebody really being assigned to him when he's out there.
Awesome. Thank you for that. I feel like several people have asked the same question about how did you get buy-in from your leadership and command staff in order to have a dog specifically for your center?
Marty, do you want to talk about that?
Yeah, so our department has always been big with animals, and I think we have 28 canines that we have in the department right now. But even like the Tales of Redemption program, that Megan was talking about before. So the fact that they've rescued 50 dogs that were part of shelters, and our sheriff was always pro therapy dogs. And so he was actually up here. That story that we were talking about earlier that was on ABC, the sheriff was up here for an interview with the media then. And then Megan and I were talking to him afterwards, and he asked us, do you ever have dogs come up here? And we said, yes, we have therapy dogs come up here, but we would eventually like to get a therapy dog of our own. And he thought that that was a great idea. And so we knew right when the opportunity came in, when Joey was first up here, like the first day that I saw him, we immediately called dibs on him, so that we made sure that, we can get him. And we knew that internally our bosses through the sheriff's police were going to support us, because they realized, the value of having that here. So it wasn't a big ask on our end for them to do it. And the fact that the program is structured, it's not just a regular dog that's coming into the center and hanging out. The fact that Megan is being certified and the dog's being certified as a therapy team, it really means something. And then the fact that they're going to different events. So we had a hiring event last Saturday where we brought Joey out to the hiring event, where people were able to see him and interact with him. It's a big deal. So it's not just that we have a dog hanging out, it's that the whole certification process and everything else that all added to what the buy-in was.
And I think it's important to differentiate the difference between a service dog and a therapy dog. Are you able to sort of clarify that?
So service dogs are certified for something specific. Therapy, like, if they're a therapy dog, the way that the training is done is that it's more training them to socialize with people, to pick up on cues with people. There's not any, it's not like it's covered under the ADA Act that I can just bring him anywhere. And that would be like what a service dog is covered under, that's assigned to an actual person, and it's there for in support of one person. So they're not really, pet therapy or service dogs. You're not going to play with the service dog. Whereas a therapy dog's kind of the opposite. Although we are getting certified as a team, because I'm his handler and I'll take him out to different events, and I'm the one that's responsible for bringing him to see other people. It's more of a socialization thing with a therapy dog.
Thank you so much. And we have another question asking about recommendations for artwork to aid in calmness, and is it to pick things that are nature or animals? How do you pick the artwork to help with your calm room and to have something to look at besides blank walls and screens in a calm room?
Yeah, I would say because it's most, I feel, common, I always go back to, nature, whether it's water or mountains or, you know, I've done one that's really cool that has more of a European kind of feel, but it's got all colorful buildings with water in the foreground. So I do go back to nature a lot of times and find inspiration there, because I think that's always really important to bring you back to that and the biophilia. But it could be, even on a TV screen, like watching Animal Planet, or, really, you can get really creative with it, and do anything really. But nature, I would say, is the biggest one.
Just
And
to add to that a little bit, I think
Go
you
ahead.
have to think about what's awe-inspiring for you. And again, invoking that emotion of the power of awe, whether it's looking at something like an animal close up, or nature scenes, or it could be some phenomenal like urban scene of some sort. There's a lot of choices, but think about what emotion you're feeling when you look at the art. I think that's what's most important.
And obviously this art doesn't need to be limited to the quiet room. You really could have it throughout your center, correct?
Oh yeah, definitely. We having incorporated it in many different areas. I would say that's one thing that gets forgotten about a lot in just different spaces. That can be really a simple, inexpensive ad to add different, artwork to spaces.
And I think we have a question of, can you provide information on the sound, the name of the program?
So if you go on your phone to Spotify, and you type in the top and search for Robertson Brain Health, it should pop up his different playlists. I know sometimes it's difficult to find. You can search also for dopamine drip or serotonin drip, and it will give you different playlists for either that calming or that energizing playlist.
Okay, as a grad student, I really needed to hear that. That's awesome. So I think funding is constantly a challenge in all of our PSAPs. So do you have any suggestions for sources of funding for a therapy dog, or for doing these simple solutions to increase the calmness in your environment?
So I'll jump in with like wellness rooms, or, what we did at Cook County was an overhaul of, different interior spaces. We know that, a lot of different centers, money is something that's hard to come by. So in terms of finding the money, I don't, we've got to do some more research. I don't know, Marty, if you know if there's other grants out there for that sort of thing, but from a cost um, perspective and trying to play double duty on things. So the quiet rooms that are in Cook County are, for sleep, for meditation, for, kind of that time out. But they could also double as mother's rooms, so they can play double duty in terms of the function of the room, which is something we do a lot in a lot of different municipal projects. Marty, do you have anything to add to that?
Yeah, I think, the part about getting buy-in from our staff, on their, so the quiet rooms and everything were part of a major project and a major expansion project, but getting them to understand, um, about the quiet room. So we kind of had an idea at the beginning what kind of design we had and everything. And then what we did was, before, we made final decisions on stuff, that's when we had met with Reagan and then explained the different functionality of the quiet rooms and how they would benefit our staff. And then we also explained about being able to disconnect and everything else. So we've had very good buy-in from our board whenever we bring up things on employee wellness. That our board has been 100% behind that. As you see at the beginning of the presentation, I talk about, where our center was and where our center's going. And if you look at the call volume, our call volume has exploded over the past 10 years. And along with coming with that call volume exploding, the types of calls that we're handling are just, the amount of shootings, homicides, death investigations that we deal with on a regular basis is just off the charts from where it used to be. So those are part of the things that, as myself and Megan being telecommunicators that are now in management, that we advocate for our staff and we explain, to our funding sources about kind of what's taken place, and look at the center's got this larger, but we have to make sure that we're taking care of our staff. And then we've looked at other centers and what other centers have done out there too. And we're seeing this trend, where other centers realize that employee wellness is something that's important, and that when you are on a break, that you want to be disconnected from everything, and you want to have a nice space, and you want to enjoy when you're coming and going from work, to know that you have somewhere to go to work at. But I realize that is an issue with funding at a lot of different places. And I wish that there were more funding opportunities available for wellness programs that you can use, because I do think that that's been a challenge, and it continues to be a challenge for a lot of centers depending on their budgets.
I have another question for you, Marty. Has the remodel changed retention? Have you seen changes in employee morale and retention?
So I definitely think we get a lot of comments from the dispatchers about the quiet rooms, about that when the people having to double back and you know, having a space to go to know that they don't have to, you know, drive all the way home and then come all the way back, that's been a big thing with them. And then when people are coming to visit the center, it's great to have as a recruitment thing too, to say, you know, hey, this is what we have, and you know, this is going to be something that you can use every day. So yeah, it has. I think that our center, along with a lot of other centers, we all went through this thing in the 2020, 2021, 2022, where a lot of centers had people leave for like work at home jobs and things like that. And so that's one of the challenges, is the people that are sticking around and staying at your center and everything. We want to make sure that, you know, they have something that's nice, and then people coming to visit see what they're going to have when they work at your spot.
Thank you so much. And we're getting a bunch of questions about the specifics of the furniture you all picked, and the sounds and the pictures and everything. So when we do all of the answers to the questions, I will ask you all for some details, so that all those people writing in and asking questions about, I want to know about the rocking chair, I want to know about the different things, we will get that information and add it when we upload on 911.gov from this team, because we are about out of time. I do want to plug that if you're a small center and you have a local community college that has a photography program, find out if they ever have assignments to do nature photography, or if you can get some artwork from those community college or high school programs. There are a lot of great opportunities to collaborate with students to help you get some of that material that you might not be able to get it through other means if you're trying to do it at low cost. So thank you so much to all of our speakers today. This was really awesome. I learned a lot from you all, and I think that this is going to be a really valuable recording for others who missed it today. This concludes today's webinar. We appreciate everybody's participation. An archived version of today's webinar will be available on 911.gov soon. Understand, I move at the speed of the federal government. It will take me a moment to get it up there. And the next webinar will be on Tuesday, September 12th, 2023, with a presentation on CAD to CAD interoperability, followed by a discussion of the efforts undertaken by the Washington, D.C. Office of Unified Communications to improve staffing and broaden their applicant pool. Thank you so much for being here. We hope that you will join us in September, and have a great day.